Welcome to the Cumbria Safeguarding Adults Board Commitment to Carers webinar. The information in this webinar was originally produced by NHS England North West and Cumbria and Pan Lancashire Safeguarding Adults Board, and it will highlight some learning from published Safeguarding Adults reviews related to unpaid carers. The webinar intends to raise awareness of unpaid carers and outline resources available to support staff who may need to improve their work in identification and support of unpaid carers in their area because of learning from these reviews. This infographic shows an example of who people are caring for and some types of care provided. But how do we define an unpaid carer? The Carers Trust defines an unpaid carer as anyone who cares, unpaid, for a friend or family member who, due to illness, disability, a mental health problem, or an addiction, cannot cope without their support. Unpaid carers can include working carers, adult carers, parent carers, young carers, carers in vulnerable and diverse communities, to name but a few. The link on the slide will give further information in respect of how to identify carers. Chapter 2 of the NHS Long-Term Plan outlined commitments the NHS makes to unpaid carers, and in particular the plan pledges to continue to identify and support carers, especially those from vulnerable communities. Carers are twice as likely to suffer from poor health compared to the general population, primarily due to a lack of information and support, financial concerns, stress and social isolation. The plan highlights the benefits of using the quality markers for carer-friendly GP practices developed with the Care Quality Commission. This will help carers identify GP services that can accommodate their needs. The plan also encourages the adoption of carers' passports, which identify someone as a carer and enable staff to involve them in a patient's care. Carers should not have to deal with emergencies on their own. The LTP stresses the importance of more carers understanding the out-of-hours options that are available to them and have appropriate backup support in place for when they need it. Encouraging contingency planning conversations and having their contingency plans included in summary care records so that professionals know when and how to call those plans into action when they are needed. The link to the NHS long-term plan is included on this slide and will give you further information. The importance of recognition and support of unpaid carers is also reflected in the NICE guideline under NG 150. You can find the link to that on this slide. And despite the recognised pressures, both Carers UK's State of Caring report and the government response to the 2016 Carers Call for Evidence, these report clear evidence that many carers did not feel adequately supported, and that although caring can be immensely rewarding, many found that they did not feel respected, valued and supported for the contribution they make. The GP Patient Survey 2022 results for Lancashire and South Cumbria highlighted that 67% of carers reported long-term health conditions. This compares to only 58% of non-carers. And carers were more likely to experience isolation, mental health conditions, and a lower number in comparison to non-carers felt supported to manage their health conditions. So how does this all relate to learning from safeguarding reviews? Just a brief look at the National Safeguarding Adults Review repository showed learning that included lack of recognition of carers, lack of consultation, involvement and discussion with families, lack of a carer's assessment, which resulted in lack of contingency planning conversations, increased risk when carers or those cared for became isolated, and the importance of collaborative conversations. Local learning from Cumbria's Safeguarding Adults Board revealed that 2 SARs in this area also identified learning related to carers. This learning included a lack of formalised approach to family engagement, not recognising family members as carers, which resulted in lack of support or no understanding of the degree of dependency, a limited involvement of family members or carers in their care planning or risk assessments, missed opportunities to recognise and respond to escalating carer stress, and the need for advanced planning or contingency or emergency planning, and a recognised need for services to be proactive in reaching out to carers. The Care Act 2014 sets out the legal duties for local authorities in respect of supporting carers. This relates to all carers are entitled to a carer's assessment of their needs independent of the person they care for, annually or when circumstances change. And also young carers are entitled to a young carer's assessment. There are no thresholds that need to be met ahead of these assessments. And also local carer organisations should provide information and advice to all carers. And that carers will be entitled to financial support if they meet the national eligibility criteria. And this is in relation to carers allowance. And that local authorities must prepare a support plan. Most carer organisations support carers to create and document a contingency plan for times should the carer be unable to care. Young carers also have a right to services that support them and enable them to live a full life, as well as protecting them from excessive or inappropriate caring responsibilities, and this also lies under the children's legislation. Some GP practices have developed a register of their patients known to have caring responsibilities. There will be large differences in the scale and accuracy of these registers, and not all carer registers are linked to patient records. Primary care data for unpaid carers is not consistent. This SNOMED guidance sets out a recommended cluster of SNOMED CT codes for unpaid carers. Consistency when coding unpaid carers will help to ensure that carers are better identified and supported across and within systems. As a minimum, systems are expected to be able to report how many unpaid carers are registered in primary care, And of those unpaid carers, how many have a carer contingency plan in records? For more information, the link to the SNOMED guidance by NHS England is attached to this slide. These top tips were produced with young carers who outlined what would help them when they visit their GP. They said they would like the GP to recognise that they have individual needs and shouldn't be all treated the same. They would also like them to think about the support and understanding a young person may need. They would also like the GP to avoid relying on young carers to interpret for the person they care for, and to think about how they can make appointments more accessible, for example, offering an after-school appointment or a double appointment. On this slide you'll find a link to a YouTube video where you can actually listen and hear the views of young people in relation to how their GPs can help them. Some systems have well-established processes or are developing processes for contingency planning. NHS England have published recommendations for ICSs relating to carer contingency planning. Also, since the introduction of the aforementioned SNOMED codes, a carer can be coded in their GP records as having a contingency plan in place. Unpaid carers need to know that if an emergency happens, replacement care will get sorted out speedily and efficiently. This can prevent an emergency becoming a crisis. An effective contingency plan will enable replacement help and support from willing family, friends, and/or services as needed. It may also help the carer to get better more quickly. There are two links on this slide, one to NHS England Carer Contingency Planning and the other to the Carers UK website to offer help and advice and practical support in creating a contingency plan. This slide shows local carer services and includes the contact details of several organisations across the county. These include Carer Support Cumbria, Furness, South Lakes, West Cumbria and Carlisle and Eden. Also Rethink Mental Illness, Child Action Northwest and Bernardo's Young Carer Support. Information on carers awareness training is provided on this slide. Encompass provides sessions on the third Tuesday of each month at 2 p.m. via Zoom. Or you can contact Carer Support Cumbria as they offer virtual carer champion sessions who are open to anyone. In addition to this, face-to-face or virtual carer champion sessions can be arranged and delivered by the local carer support organisations across Cumbria, and their details can be found on this slide. And finally, to note, carers and safeguarding is nothing new, as I'm sure many of you will know. There's a link on this slide that will take you to the Local Government Association Carers and Safeguarding briefing, which is a briefing for people who work with carers. And we finish on a direct quote from a carer. This briefing is talking about ordinary people, carers and cared for, who find themselves in potentially extremely difficult situations that they didn't choose, with immense emotional and practical implications for their lives. There are a plethora of resources available to support you and to support unpaid carers. NHS England have a futures platform that contains information and, amongst other things, links and resources on projects carried out across the country, such as hospital discharge projects and Mind the Gap projects, which focus on identification and support of carers from more vulnerable groups and those who experience health inequalities. Thank you for taking the time to listen to this webinar. You can visit our website at www.cumbriasab.org.uk, and you can follow us on X, formerly Twitter, at #CumbriaSab.